negative effects or economies in terms of goods and services. One more buono ecosro. Then of course free primary healthcare. Materials who for diet be see now be sending me kind of new year. Yes, almost bought a banner basso for that implementation of CCR.
WHO for crab President Mahama Abaso.
I see.
For the free primary healthcare.
No.
Now, me as a young doctor, I need just say mommy because
doctor, medical doctor, me one.
Yes.
Dr. Samuel, medical doctor.
When you go around, you know the difficulties we face. Me can say more medical school. No?
Yes.
Now you will be a friend of Kubis. The full meaning a community-based experience and services.
Okay.
Now a very interesting model. Now you eco villages. A cotton hobe 4 weeks be. Now yes you mini the health system no etimi interact directly. Cheap compounds, health centers, polyclinics, and what have you. And it was a very interesting experience. Now, when you say experience now, then you understand the difficulties I have in our health sector. In the time I President Mama, I can't say obey free primary health care, even in opposition. Now may manage because I knew say it will be one of the major things Ebeboama Ghana your health sector no jina brand. Mamefa akonya iso embo President Mama Baso. Wachere say oyanokafo ode hoto no so a eyeye. Se Ghana for the omore shen mo say washebo no bedi so a eyeye. Because asemo okan ye se obeboa ma Ghana ya pomude nsemo no ejina brane se obeye Ghana medical trust fund e san friend Mahama ke eye omo a yare krankro ene omudi esi eye hypertension, diabetes, stroke, cancer, kidney failure eno ede dialysis sebni ade ba nyina no President Mahama share ho bo obaye so wadi so free Ghana Medical Trust Fund ebo adwuma yie pa under the leadership of Madam Obobia. Free primary health care so President Mahama instead of mekan no wadi sa boshe no so na wa launch ne kama amefa kwenye so mbo health minister on a national health insurance scheme mpanyu mebo mabaso for the collaboration near adwuma pa o maya etimede sa program ya ba rounds for babies as a DNA free primary health care. Free primary health care the first and the most fundamental care ubenya hospital. So hospital ayaresha ubenya eno ne de edi kan pa mfaso kese pa woso pa. That is the definition of primary health care.
Okay.
In fact, in 1978 there was a declaration in Kazakhstan. I refer to Ama Ata Declaration. And we define a primary health care as a major human right issue.
I see.
So we nipa yes say one sample one ye bibi akra na or the opposite in some.
Yeah.
When ya share cry the free primary health care or primary health care they say dey e ko yi na twa yi na etimide mfaso de pi ye dey ebro. Enti President Mahama kan say Ghana apart from vaccination activities apart from memo so antenatal care, antenatal clinic, apart from nkola numa so ni niema kitikiti that particular population. If primary health care no ohwe baby a Ghana yare sem etina on say nkan no na yare ne kitikiti.
Yeah.
Malaria be typhoid be utie o ya wakodi de aduane bi ama oyem hwie yare kitikiti nya de a na ha drink gidi bia but ena be for aba transfer adwuma wo yi enya de also ya no pa oti awiem ana se wo koba oti akonyam sa esisi so
enokra
ubedidi a aduane a wakoto wabonten na wo ba bedi emu nama ye de anwa ache emu ngosua ne ade enti ama ye lifestyle no ye te se amanone. They have a particular trend of diseases. Hypertension, diabetes, cancer, and what have you. Now, for the past few years in Ghana, yare no ya sad ni bi.
see.
Into Besha. You see, Sayari Amabu na diabetes, hypertension, stroke, cancer, sickle cell, and what have you. Heart failure, kidney failure, and the academic nano. Your friend of non-communicable diseases. Ushemua, Sisiano, or Hamun Chemu Eduonum, Pepe. Almost 50%, 45 to 50%.
45 to 50%.
50%. Ghana for almost sure na sa yare a mabubo idin
Ebi wo mu.
Enye say ebi wo mu eno na okabo ma a claiming the half of mortalities.
Wow.
Enti nipa 100 wu o Ghana emu 50 say enye diabetes and hypertension a heart attack and kidney failure bi ana say cancer bi ana sickle cell bi ana yare a etesa no because of our lifestyle over the years, especially diabetes and hypertension. And abeye a major pillar, a major problem confronting our health sector. South Krobi so na nipa emu 100 wua, emu 50 eye from area eye related to lifestyle. It is a major issue. And so my opinion say any say primary health care no or the or befa kwan bi so ama yetimi aye yearly or all year round screening, education and monitoring. Just on chair my own man menya diabetes and my own man menya stroke. On chair my own menya diabetes and my own man menya kidney failure. On be chair my near man get my own konkonya cancer. Na baya be bon ka na wanka so wa be bon ka abetim pentin kwa ama busuanfo sika nyina ahye. Asema mekan omo a omabusuani bi ahye ne nkwa because of kidney failure and kidney disease no. They relate with me because omunim how e kai de ewom. Enti se President Mahama shebo se obeye sa niema we na o se ebo na baso. Enti se o hwe bibi ti say one of the things I person here in the phase 1 of this free primary health care breast cancer screening. Ghana afibia WHO my say a ma 30,000 omunya breast cancer. Ye screening afibia ye screening annually 30,000.
We are singing na.
Ghana
kwa.
Now just are going to 80.
Hey.
30,000.
30,000.
Yes. Out of that 30,000, emu 2,500 na share mo kwa afibia.
Hey.
2,500 nya numbers wo ye nipa nkwa asem na make wo. Imagine say nipa ba 2,500 no ma share mo kwa because of breast cancer.
I know that.
Yes. In fact, we Ghana cancer say ku nipa nyina na emu 13% breast cancer. Cancers be brain na Ghana.
Yeah.
Nti e na ba konkon ade it mean for 13%. It should tell you the seriousness of the matter. Now, President Mahama, as part of the primary health care, you see a cheap compounds which are already existent. Health centers, health posts, and what have you. Community health workers, they will be touring our communities. Now, my screening of breast cancer. And yes, I find I ever try October. And so I see I be a friend of Pink Month. And so I have breast cancer screening by people who are not even funded by government. And to a paranoia. Because enya abai sika no dey. Opa abai na 1 hour peno wajai. But President Mahama say as part of the primary health care no, ye the sad no shim. Said ye be ya ye ma menum ni enua mamu a breast cancer how mo yetimi anyom ntem. Na yetimi a prevent mortalities or deaths that are related to breast cancer. Because when we say breast cancer, it is a cancer, it spreads 1 year, 2 years, 3 years. The way and manner it was in the last year will not be the same now.
I see.
So last year was stage 1. In the following year, we made to stage 2. The following year, we made to stage 3. We do stage 3. And you had the bit me aside there. I come back.
Could be okay.
In President Mahama so on try my own could do stage 3 and stage 4 na answer who. Asase na near who. Na ya pay area no. Ya 2 year na say. It is part of the President Mahama person here. Another one glucose monitoring. Into the FDB is checking sugar, a friend of glucometer. It is part of Niema, your community health nurses in the bay. Ghana, Ote, Usim pam, say, or call hospital be aqua check you sugar over to any free.
And okay.
You will pay. But the Ghana for drona about 9% we Ghana from paying for 12 one diabetes. We or more man cause I said aqua test you. What about more move your
test?
Are more several complications of diabetes that they don't even know. And as part of the primary health care, no, you the beka sa package no hama. O ye dwadini na wote market. And now your driver ni wote lorry station. Ya besi health post bi wo ho. O sorry fi wakonya so betumi akọ ra akọ check your BP, akọ check your sugar, akọ your screening. Na ye hwe na bibi wo ma, yetimi afa ho refer wa ma o hospital kese mu a ebe hwe. Even if it will be covered by National Health Insurance Scheme, and now say also Ghana Medical Trust Fund. All these are parts of SARS screening exercise here for so pie also. And they back one. And also one by a say be check your BMI. Unim BMI. BMI check body mass index.
Okay.
Say be share umudro no and nothing because untimi nya nipa tietia na umudro no eni so e wo so pa.
Oh, Samon.
Yes, because SI say height no weight no, it doesn't match.
And you share height, you know.
Sir,
I say to me corresponding with weight.
Weight until we calculation now until a weight over height squared until weight is 70 kilograms.
Yeah.
Near divided by our height. Maybe our height is 170 centimeters. Until 1.7 meters.
Okay.
Until 70 divided by 1.7 squared.
Okay.
Until say below 18.5. We underweight. There be. We underweight.
Okay.
Between 18.5 to 24.5 normal.
Okay.
24.5 to 30 overweight.
Okay.
Above 30 obese. Just say also. So there were a lot of risk factors.
Oh, some.
Yes. There were a lot of risk.
Akesieno.
Oh yeah, kesieno. Just as I about diabetes nya.
Easy.
Easy. Hypertension nya easy. Unya diabetes na hypertension so na one treat here. The complications they say ubenya kidney disease, ubenya heart failure because o BP was so and then ma akoma no body den akoma no so ba ebebre. To bon say obi wo na akoma ayekese because the heart is adwuma broso. Now father dey cry say wo dey jeme won say omo mema ye omo peja dade peja bi omo peja dade so peja dade a wa beti ye kese ba akoma no ni kwa say no so ye kese
sa wo ye yira enso akoma no ye kese
dey be nya sana meka dey make can say the way a wo peja dade a de bia wo peja dade no
aha no grow no
sa so na wonya o hypertension na o akoma no bo den a akoma no so ye muscle to say onsa.
Okay.
And also by kese by no any kwa say kese because kese ayare.
Oh, okay.
What you say?
Okay.
All these are complications of hypertension and diabetes. It will be hypertensive cardiomyopathy, diabetic myopathy of the heart. So what you say? Now your complications of diabetes and hypertension and the count. It's present mama so no dey on try ma wo medu sa ho no. As part of our primary health, I will Ghana na ye no. Or the sanima we are enkane na enka hono. Ka ho ama. Said the beya all year round. We can utilize our community health necessary. You better be account because of this program no. No metimi akoso educate Ghana for the drona. Oma koso screening Ghana for the drona. Oma koso enya the opportunity to counsel Ghana for on these non-communicable diseases are making one semi. OTS as part of it, you better screening exercises for Nkola or many eye test for Nkola, dental checks or sing waso bibia for Nkola. OTS these are all parts of the primary health care for phase 1 for 150 districts across the country. That's for what they make an say. Martin say before na no mo keka so. Nema aye keka ni na o national health insurance scheme.
Yes.
Mesre wo.
Na ka me kra me ba ho.
Sa nema na
Sem omo sem no omo ka na mu nchire mu tisen.
It doesn't make any sense. First of all, national health insurance scheme e cover nipa 66% of Ghana.
66%.
Yes, of Ghana.
Okay.
And cover Ghana Ghana need because Ghana need 34%. They have not registered on national health insurance.
Maybe can 34 no.
No can
Maybe yeah. To be frank with you, I mean, I don't have
such
national health
paper.
insurance, yeah.
But primary health care there, so we're Ghana need there. You have access to it.
Okay.
Number 2, primary health care. Say President Mahama can run a preventive.
Okay.
Say it is preventing you from getting where you are not supposed to get to.
Okay.
I said, I can't on train my own heart failure and sana. Yeah, sure. Even though Ghana Medical Trust Funds force or shank of what it is, but I ain't train my own man be do answer. Whilst primary health care is preventive, NHIS is curative. NHIS no. Obeko hospital the health insurance card akwa na yare dida.
Okay.
Yare no yare wie dida.
Okay.
De ebe ye wo no aye wa wie dida.
Okay.
Edro na ye de kwakoma wa na asasa edro ntimi nkio wa management na ebe de ye be manage you.
Okay, nti o yare no and now we use health insurance card no.
That is when you use health insurance card.
That's true.
Can you pick your national health insurance and say uko screening?
That be.
Because national health insurance ye be bele wa.
I say more drew. Ana
There should be a diagnosis.
okay.
But wo no ye ma diagnosis.
Okay.
Enti uko yese uko ena oti hey uko ye screening na ubetua.
I know there.
Enya free.
I know there.
Enti ensoso he kase pa na da primary health care ne health insurance scheme nim. Ena niema ye under primary health care ni na mabobo din ye. The primary health care that anya president mama free primary health care.
Okay.
No. Primary health care that na ye so nkole num ye ma me ma fa furu.
Yeah.
It's animal. It is not covered. Enye national insurance can there.
I know see another program on it.
Normally donor funds. Okay. USAID, UNFPA, UNICEF, just say a lot of donors. Almost can hear yes, and so the moment they withdraw their donation,
I just said no.
There's a problem. What you say? There's no coding in national insurance bill na. You say, "Oh, sorry, I got to hospital so we could screening na." Untuyeska obetua.
But we don't ya.
There be free primary health care. President Mama Nkasa na atoto ne glucometer, atono ne sphygmomanometer, wato ne measuring scale. They be measure weight no height na ade. Aye education. Asha ya rank tenketi ya be mo munro na omo de ama amanfo a omo hu for omo. That is what it's all about. And it is preventive. And health insurance here curative. But you see, the problem with the MPP is that policy bar omo nyehu ye enye debate papa. They tell say anya MPP before no metra akonya so 8 years health insurance can normally tabno to so ko ye niam na emfa health ho no. Onkai. Yes, they put a cap on it. They almost capping and realignment policy. They did some for NHI, they did some for Get Fund. That's the guy also call a health insurance when omre tabron to so kakra bi pen na omre ko. Na ya den na what the health insurance abro say. O done who within a space of 1 month, a space of 1 day. Now suddenly you are hailing national health insurance when all the problems associated with national health insurance I want to buy. You understand the point I'm making? So really, any idea also so national health insurance scheme is doing what they are supposed to do. Nyamencha the primary health care is receiving about 1.2 billion Ghana cedis from national health insurance to fund this. So it is a special project. President Mahama said that actively we can encourage early diagnosis. We can bridge the inequality in terms of healthcare access, or more money insurance, they can also get primary healthcare. Na ye ato ye. Enti your policy me personally no manage home because me experience as a young doctor, I've come across so many difficulties. A lot of people face. Enya dia eboa when it comes to taking care of our people. And this our policy way a policy papa also Ghana for soon. In the next few months, I know say health posts now make one seven. It will be set up in various marketplaces and lorry stations and what have you. Quickly. Obi a betimi akoye ne ho nsanchene kakra obe check ne ho kakra na bibi boni bi wo mu a yetimi a refer you to the appropriate places. Ama emfasode pa aba program. So it is a good policy. It is a policy designed by His Excellency President John Dramani Mahama to promote access to primary health care and to make sure say Ghana for apomudin ayade ejira brani ye pa in a way and manner accepted internationally by WHO and all the international agencies almost share ayarehwe no ntemedie me bo president Mahama abaso me bo health minister abaso me bo mpanyefo ahodo na abaso for this beautiful program edemfa so pa ebe Ghana.
I'm rapping the be dey attach because I think some more opponents almost start threaten this policy. When ABI in the future regime SSR, they are saying say I don't know whether say education be only start here or in chichimu na eko. Say national health insurance no IBN. In fact, I've heard from Samuel Oku, Cracker say Ghana Medical Trust Fund, aka Mahama case no, duplication, banner national health insurance na. So on board between now, mobile no. Okay, national health insurance or more introduce
no sabe
primary health care.
Sabe okumia me bra panyi pa me obo ni die ma no. Na when omo aban mu na omo tabno to health insurance scheme so a.
Yeah.
Na sika nkomo health insurance egu e no. Na okromo a. Then suddenly what me who's a national insurance scheme for so and until was say or no be kan ho asem.
So it's these two major interventions our health sector then I'm obey the abon buying.
Now say Ghana Medical Trust Fund the parliament approved it.
Okay.
Emirate is about the so just say the same members of parliament.
And I can see MP.
And
yes.
Now be sure nyamnya numa kase obi a wenya bibinti wenya kidney disease wenya renal failure Ghana Medical Trust Fund na Mahama Kena etua na ho ka ede Ghana for into one kakra ye na agege ede ma health insurance no ede tua Ghana Medical Trust Fund ka obi oda dialysis so obi a wenya heart failure obi a wenya cancer na ni da so a ne Ghana Medical Trust Fund e friend Mahama Care president Mahama de aba no obehwe nyamya nim ayi sa policy ya etoje wa. So if you are a responsible opposition, now Ujidi say you must gain credibility in the eyes of the people. And also image in the eyes of the people. Now on my phone also dowa. Why would you be in opposition and be threatening a policy that is inuring to the benefit of Ghana for? Me say Ghana Medical Trust Fund MPP nina unya kidney area intimation. Rounds for me bisa Oya MPP ni na unya kini area. Na yese Ghana Medical Trust Fund e be hwa wa ma ho ato no wetimi anyi da afebo a onje ana
obeje.
So why do we use politics to run down programs they have been designed to save our own lives? And Isabel kwakapim no for no a omoto abama no. Enti so obi ebenya kidney disease, obenya cancer, obenya yare say yes, Ghana Medical Trust Fund ebeshana because oya MPP ninti no oma na nhwe na. It is sometimes I will say a man no credi ni ye attach a human face to whatever we say. Ode dwenhu mienu dwenhu koda oda sumie so adwenhu say it Ghana Medical Trust Fund omo a sa fund the air shop no nti sabi omo nya Ghana fo ana.
I see.
I don't know, Bibia ni akota ya manyo semechi na ye run it down programs eba be save yankasa yenkwa.
I see.
Because Ghana Medical Trust Fund enye Togolese for na ehwe mu.
Enokra.
Ghana for na ehwe mu. Enye Burkina Faso for na ehwe. Ghana for na ehwe mu. Enti adana wani mpo nje say abaya fa kwan bi so accredit a special unit. Aye de ehwe mu a bibi nti omonya diabetes, hypertension, ehun complications, cancer, sickle cell. Why? And so the oil opposition The Obayana said the Bia criticizing government even when you are not making sense. Is that how opposition is done? Yeah, your opposition, yeah, yes, how. Yeah, your analysis, Papa, yeah, criticism, Papa, and this kind of criticisms are Mutia Moye. Opposition, yeah, money truck, I say you.
Oh, Sabon.
There be one more than some money truck. Because if me MPP near, and can make a press conference about buy basso for this primary healthcare program.
I will share BC, said the Okanwe.
I can't because this program is coming to save the lives of Ghanaians. It's come to save us. Ghana for you na need just some to me sorry no ako right health post say check BP near check sugar. So what diabetes yet me show tell no one go womb. Into your position and you are kicking against this policy. And just how cry no. I am an saying na way who need Ghana for one dog. Who need Ghana for one tema. That is what the MPP is doing. And the Ghana need beer or tear me we should be clear in their mind. So this program is a good program, it's a good policy. Now, and some MPP before can you now and someone who person with the good program now. Some people before pa say another you cannot force a horse to drink water. And I can't say you can force a horse to the river, but cannot force it to drink it. And so young people need our share because of our manual 70. It drew on our pa. No, what Jana was showing Yamin Maku. Sa pepe, boy. And Tienya sad no Sama your Samba Sabasa, and Yadian Faso, a waffle. Okay, it is not good for our country, it is not good for our future, it is not safe for us. Now, Obi, yes, it. The part the akokotoko na enye de yemona bro no food ya pa so na ede ye piano aban no food ya pa e wo Ghana fo apomode ho ye moa no na niam ntimi nkoyie na ye 90 minyi nche na ya renkete ade bia agi ebi mu enkwa fi om nsem no ye timi ako ama na ye kama o ti ase because diabetes and hypertension ono maduru a eye o te say normal person no because Ransford so BP 180 over 120 enye. But the moment ebe mo adro no, ebe ba 120 80. Okay. Na so only BP cry dey. That is what is it in adana. Yambo amani ade papa enkoso. Na ye na ho ntoye.
Etimo mo tonkoso mo ho de ro say de wahasi ya no.
Yes.
So that Ghana for na nkasa ebe tiase no kire bi no. Ekokoba so mo ba na omo bedi na omba be tekia na mo bia na ombetu
na oni say Ghana for na kasa sisi ano omeni omani da ho
Ghana for na da ho pa
aba na wana ade ewo sogu nanu ma ompa wan na oko hospital say oko check the sugar ye ginis ka aban aba o say the free premier health ka aban e be check the free a ompe na wo ompe
because about health there you find your politics
there be health there apomodin someday I mean why would you do politics about it
yanko ye PC about center for Adam Makambi e boy yen sanso so and at Ted Convention Center wani hu ya die bia na ho and now the be call ye North Ridge Airport Residential Area obe frezo 245938389 National Lottery Authority NLA say ye mom kokko say wo ho no bi send numbers bi bro say J for cash kakra brand we air linked numbers are ebe born na numeri ya alhaji ne wade say eje no kre NL no your games no purely games of chance education and society alert don't be scammed, play responsibly over 0266808749 46 Mr. Kill product bakwa Kulun Ghana Limited for the aba Mr. Kill member drunya be boy papa na onso atimi afon to my prefer maybe restaurant ho ene ye kwako didi kama na wabo wonum tonton ade da so ho heba clinic Dr. Elder Wusu say